Our group has decided to research the clustering of the sacroiliac joint, which is commonly referred to as the SI joint, and we're looking into the degeneration, dysfunctions, and traumas. So I'm going to start by presenting the SI joint anatomy and the history of the SI joint dysfunctions. The SI joint is between the sacrum and the iliac bones, which connects the spinal column to the hips. The SI joint is supported by strong ligaments such as the anterior and posterior sacroiliac ligaments. Typically, the SI joint has little motions, and the primary function of the SI joint is to absorb shock between the upper body and the pelvis and legs. Generally, SI joint dysfunction is caused from too much, so hypermobility and instability, or too little, so hypomobility or fixation of the joint. Most often, this is caused from looseness or tightness of those supporting ligaments. SI joint dysfunctions is most commonly found in young to middle-aged women, and it is typically felt in the lower back, so the lumbar region, and the buttocks. The most common cause of SI joint dysfunctions is osteoarthritis. This occurs as a result of the damage and deterioration to articular cartilage, causing friction between the bones of the SI joint, which results in wear and tear of the joint, ultimately leading to pain. Pregnancy can also cause SI joint dysfunction. During pregnancy, hormones are released, which allows the ligaments supporting the SI joint to relax, preparing for childbirth. This ligament relaxation permits an increase of motion within the SI joint, causing increased stress on the joint. Additionally, the excess weight and change of walking patterns, which is also associated with pregnancy, also puts stress on the joint, which could result in SI joint dysfunction. Other common factors that cause SI joint dysfunction is any condition that alters the gait. This could include difference in leg length or pain in the hip, knee, and ankle. Inflammation in the joint, also known as sacroiliitis, can also affect the SI joint, causing degeneration. These inflammation disorders include gout and rheumatoid arthritis. So I've just covered some of the sacroiliac joint dysfunctions and the history surrounding them. So now Stephen will discuss the signs and symptoms associated with the trauma to the SI joint and SI joint degeneration. Thank you.
As Grace mentioned, the main function of SI joint is to transfer weight to and from the lower and axial appendicular skeleton. The symmetrical SI joint is located at S1 to S3. So SI joint should be fairly stiff or rigid link between the pelvis bone and allow only a few degrees of movement. In some people, due to trauma or just extra mobility, SI joint have too much uncontrolled motion. This allows SI joint to adopt an abnormal or stressed joint position, which may result in SI joint pain. SI joint dysfunction has many potential causes, including a minor traumatic event such as falling on the buttocks, automobile accidents, and sports injuries such as accidentally slipping or twisting, or getting pushed by an opponent during athletic activities. Stress can also be placed on surrounding SI joint ligaments when the pelvis rotates on one side either in an anterior or posterior direction. The pelvis asymmetry can be found by comparing the left and right side of pelvis. SI pain may also be caused by inflammatory arthritis. There are two main groups of SI dysfunctions. First one is hypermobility, and the second one is hypomobility. The core muscles, which are transversus abdominis and oblique abdominals, through their attachment to the iliac bones, helps closure of pelvis and improves the position, control, and stability of the SI joints. However, when these muscle groups are weak or lack endurance, SI joints are vulnerable to excessive movement, which can lead to SI joint hypermobility, dysfunction, or instability, and subsequent SI joint pain. And now I'm going to pass on to Sue to demonstrate some orthopedic tests. Thank you.
Hi, I'm going to be talking about SI joint provocative tests. Two recent studies by Laslett et al. And van der Wolft et al. Have demonstrated that there is not one perfect SI joint provocative test and that can be performed to definitively diagnose SI joint pain or dysfunction. There is no gold standard. However, by performing several tests together, this increases the sensitivity and the specificity of detecting SI joint dysfunction. There are 5 provocative tests generally used to assess diagnosing SI joint pain: the Gaislin Faber-Patrick's test, thigh thrust femoral shear test, ASIS detection test, and the sacral compression sideline test. Laslett et al. Reported that the accuracy of detecting SI joint dysfunction is increased when at least 3 of the 5 tests are positive. Van der Wolf et al. Reported that at least 3 of the 5 tests were positive. Then there was 85% sensitivity and a 79% specificity for detection of SI joint as the source of the pain. Interestingly though, another study by Kochmai et al. Concurred with these findings, but did note that the thigh thrust test alone was almost as good at detecting SI joint dysfunction as a single test. While researching for the orthopedic test, I came across the Fortin finger test. It is a simple test with a sensitivity of 100%. The patient is asked to localize the pain with one finger. If the patient points immediately, inferior and medially within 1 centimetre of the PSIS, and then asked a second time to repeat this result, and if it was the same, it was deemed as a positive test. This test is used for localizing sites of injection for treatment of SI pain. So they would turn around and they would generally just point in the specific area immediately, medially and inferior to the PSIS. If they repeated that test twice, then it was deemed positive. Sue is going to demonstrate some more tests soon.
Hi Ben and Ken, I'm just talking about how to diagnose SIJ dysfunction. So I've spoken to my chiropractor about this. He's really good at SIJ stuff, so he said the most important thing is to take the history first. It's very difficult to distinguish SIL5 pain from SIJ. When people complain about pain in their back when they're sitting or standing for long periods of time, this tends to be SIL5 pain. But when they talk about from sitting to a standing position, getting in and out of the car, or complain about pain in their groin, that tends to be SIJ dysfunction. So he's taught me a couple of tests that he uses to diagnose SIJ, which I'm going to do on Dalmain. So the first thing is I'm going to put my hands on her PSIS, and Dalmain, if I could get you to bend forward slowly and back, and do that again, forward slowly and back. And the second test is if I could get you to put your knees apart with your toes pointing to either side of the room and back, and I can feel that moving perfectly. So we're looking for movement of the iliums on the sacrum. The third test is, Dalmain, if you can please lie face down, prone, and keeping your legs straight. If you could lift one heel to the ceiling and back down, and the other, and back down. Do you have any pain with those movements?
No.
Okay, so that test is negative. If Dalmain had SIJ dysfunction, she wouldn't be able to do those movements. So that concludes our presentation on SIJ. If you liked our presentation, please hit the like button below and subscribe to our channel.